Hi, I'm Zach with UCOFW, and here I'm actually going to do a video response to Joe Biden. Has been asking people here recently to give a video response on what we think about the new health care plan. But first of all, I want to tell everybody that no matter what, Republicans or any people or any of the rumors you've heard of, we are not going to be a socialized health care. As far as that goes, socialized medicine is usually in other countries, and it has some good and bad. I'll kind of explain what it is to you. Socialized medicine is everybody in the country will have the same health care, no matter what your economic, how much you make, period. Which can be a good thing because it means everybody gets the same health care, but also a bad thing. Say if you do have cancer and you'll be on a waiting list for the heart or something that you need right away, you'll be on a long waiting list and possibly you would die. I hate to say that. But here today what I want to do is I'll tell you a little bit about what they're going to do, and then I'm going to switch over to Seneca and he's going to tell you the pros and cons about the new healthcare with Obama.
My name is Seneca Harris. I'm here with the Urban Coalition of Freelance Writers. Today I'm just going to go over a few benefits of the Obama administration's healthcare policy. One of the benefits of this policy will be that people with pre-existing conditions and disabilities such as cancer and other terminally illnesses will be able to take advantage of this program. Also, there will not be any yearly caps, which that's definitely a good thing because under the current healthcare situation, that's not really prevalent. Also, there will not be any gender discrimination, no annual or lifetime caps on all coverage, and family coverage through the age of 26. No policy renewal will be refused, and also voluntary programs for special needs will apply.
Alright, I just want to add a few more things to that. Mostly, one of the big things is that the government is going to stipulate, what the cost of healthcare is. So there's only going to be a maximum of a deductible or a premium or a copay that you're going to have. So they're not going to be able to be skyrocketing anything that you have now just based on whatever they choose. Another thing is they're going to have to help you out with your preventative, I guess you could say called preventive maintenance. So if you need to get your eyes checked, you need a mammogram, or you need to check for diabetes or any other illnesses, they're going to have to cover that ahead of time. That way, you can prevent forever having any disease after that. Also, the family plan being extended is, say you have kids in college and stuff like that. If they're still in college after 4 years, it's usually only covered under the 21 years old range. Now they're going to extend that to 26. So if you're on your family or your parents health care plan now, you're going to have a little bit longer, which is great. Finally, it's going to be a lot easier to afford health care because especially for people with Medicaid and Medicare, all their prescription drugs and things like that, they're going to have to drop the prices on those, because I know even with my family, my grandmother was paying almost $1,000 a month in just prescriptions, and they're going to cut that down big time. That way people can still afford health care, or people who don't pay for health care now that are senior citizens are still going to at least be able to afford to still stay alive, which will be good for everybody. And finally, we're going to have a few more voluntary programs for the disabled people. So if you already have insurance and you're disabled, nothing's going to change. Even if you're regular, nothing's going to change with your old program. You're just going to add a few more benefits, and especially for those disabled people, they're going to have kind of voluntary.
In conclusion, we just want to let everyone know, for more information about this policy, you can visit the White House website, and that website is www.whitehouse.gov. And also, if you would like to check out any of our other videos, the Urban Coalition of Freelance Writers, UCOFW, you can check us out on YouTube at www.youtube.com/UCOFW, or you can check us out on our MySpace page at www.myspace.com/UCOFW. And also, if you have any comments, or if you would like to add us as a friend, or if you would like to subscribe, feel free to do so. And remember, this is UCOFW, where we shine the light on issues impacting the urban community. Thank you very much, and check us out.